Go. Over there. All right. I would like to call to order the monthly meeting for February 22nd, 2022 for the Rockland Board of Health. Those in attendance are Janine Oliveira, Administrative Assistant, Health Agent Delshorn Flip, Member Christine Stewart, Member Cecilia DeRosa, myself Scott Margolis, and Kathy Ryan, our Public Health Nurse. We also have a guest in-house. They'll be doing a presentation, Michael Hugo from the Massachusetts Association of Health Boards. There you go. This meeting is being broadcast live on WRPS. And with that, I would like to entertain a motion to take out of order the COVID-19 from old business and take that first on the agenda.
Motion to move the COVID-19 update from old business to first on the agenda.
I have a motion and a second.
Second.
And a second. Okay, all in favor? Aye. Okay. With that, COVID-19 update, please.
So actually, I'm going to start by saying, I believe it was at our December meeting, we instituted a conference room mask mandate. So I would like the board to either extend it or end it at the board's discretion. If we want to have conversations about it.
Do you have any, how are we looking at numbers and that kind of stuff? Getting a lot better?
The numbers are,
Yeah. Yeah, so last month we had 1,204 cases of COVID, and as of today, and I know a lot of it's the home, we're doing home tests and all that, we have 90 cases. So that is huge,
Okay,
huge
that's
drop.
a huge difference.
Right, but again, you and I know that these home tests are not being reported to Maven. Those
Right.
people are out there doing the tests, and they're not getting reported. So 90, like that's like, wow, you know, so they're way down. Will that change?
That's good.
We don't know.
Yeah, I do know that as far as the hospitals go, hospital admissions have come down quite a bit.
Yeah.
I haven't heard anything on the, for the proper term, but the waste testing,
Yeah, I haven't heard anything about that.
you know, because that's the true number is they're testing the feces at the treatment facilities, and that's the actual true, real number for it. But yeah, generally speaking, the numbers are coming down. Vaccination numbers are going up, which is awesome. So with that, any discussion on the possibility of redacting the mask mandate for town-owned conference rooms?
Nothing to discuss.
Okay, in that case, I will entertain a motion.
Okay. Motion to, how do we say that? To,
When you speak up.
go ahead. So motion to, I don't know, close out? Release the mask mandate at the town hall, effective immediately.
Okay, so I have a motion to release the mandate for mask usage in the town-owned conference rooms, correct? Okay. Do I have a second?
Second
I have a second. All in favor? Okay. It is now released. So now people can remove if they want or keep wearing it. So.
And I will too. 'Cause it is hot.
Yeah, would like to add, it is always, if you can't socially distance, please, consider wearing a mask. All right, great. So next on the agenda is the Board of Health bill vouchers.
and you saw the list, there's only actually one bill that I need to sign.
Price on this has been holding steady.
I'm sorry, what's that?
The price on this has been holding steady.
The price on that has made our budget for fiscal year '22 go in the negative for that line, because we had only budgeted so much because we were together
Yeah.
as a group. However, we are bottom line budget, so budget going for fiscal year '23 because of that,
But we've seen the positive aspects of separating.
I think so. Yeah, it takes some time, readjusting for everybody,
Yeah.
but yeah. The bills, and I tell residents all the time, the bills you will always get at least 10 days after you get your water and sewer. So,
That's about right, that's what I think.
yeah, I do billing on the first of the month, depending when the bill, when it falls, if it's a weekend or whatever, but I generally do it on the first. It takes them 3 days, and then they send it out on day 5. So there's a procedure, and
Yeah.
it's taking about 2 weeks. Water and sewer usually do their billing on like the 20th of the month, around the 20th to the 25th.
Yeah.
They get their bills, and then mine will go out after that.
I actually think I got ours before the water sewage this month. Oh, whatever, doesn't matter. It's paid out of the way. Okay, great. So that's all set. So that's in the bill vouchers?
That's all.
That's one.
the
All right,
bills.
next is trash abatements.
I apologize that I didn't get those over to you guys sooner, but this morning I did.
Oh, no, I already reviewed.
Did you review
Yeah, I
them?
reviewed them, yeah.
Yeah, I reviewed
Yeah,
too.
really not that many.
Do you still have this?
That's fine.
So I do have one question. The first one, Ricardo De Leon, bill month is October.
Yeah, I had left it off at the last meeting in error, and so that's why there's interest on it.
Okay.
I found it, I put it in the wrong billing spot. He was supposed to have gotten it billed, abated in January.
Okay. He doesn't need an abatement for the February one?
No, he's here now in the US.
Okay. And then the other question is, Myra Kelleher. It says a 2-family, 1 unit's vacant, but I only see a bill for 1 unit.
Because that's all you'll see. She's already paid $98. I'm abating $98. Her bill is normally $196,
Yep.
but because 1 unit's vacant, it's only $98.
So then what are you abating if the bill's already
$98.
98?
1 unit.
2 units, she's using one, one's empty, so we're abating the empty one.
So I'm abating $98 for 1 unit.
But it looks like you already did abate it, though.
No, that's what she owes. That's,
Okay.
no, she paid $98. I'm abating $98.
I get what you're saying. Okay. So
that's-
she paid, this is the bill after she already paid $98.
Exactly.
Got it. Thank you so much. That makes sense.
Oh, it's not on? Oh, thank God.
Thank you. Thank you. Bless you.
Sorry.
I think I might have done the wrong one.
No. sorry.
She needs
Oh,
it back?
yeah, you did. It's on your copy. There you go.
Oh, you did. Turn it over.
See, they're listening. Oh, they do a nice job down there.
Okay. All set.
All right, great. That's it for that. Next is new
Oh,
business.
I'm sorry, did we
Oh,
approve those
we
abatements?
didn't. I'm sorry. You're right. Totally skipped over that. Okay, I'd like to entertain a motion on the abatements.
Motion to approve abatements.
I have a motion to approve. Do I have a
Second.
I have a second. All in favor? Aye. Okay, thank you. Next is, under new business, so we have Michael Hugo with a presentation from the Massachusetts Association of Health Boards.
I don't know where you want me to stand, or...
You-
On the floor would be fine.
Is this to read?
Oh, yes, you can move that down.
No, but does this advance the...
No, I do.
Oh, you do?
You just tell me what you want me to do.
Multi-talented, okay.
Listen, I got many hats. IT today,
Here we go.
health agent tomorrow.
Okay. So I'm Mike Hugo, and I am the Director of Policy and Government Relations for Mass Association of Health Boards. I want to thank Scott for inviting me to come here today.
Thanks for coming.
And so MAHB, next slide please. MAHB elected and appointed members of boards of health across the state. We are your voice and we are your resource. We're here basically for you. And I'm here today providing technical assistance. Next slide, please. Technical assistance and education, and I'm not here to give you legal advice. I'm here to basically teach you what your duties and powers and responsibilities are as a board. Next slide, please. MAHB offers several certificate programs from Taunton to Marlborough to Northampton every year, with programs ranging from soil evaluation, how to hold a public hearing, how to run a public meeting, how to deal with public records, and even things like how to close down establishments that deal in human sex trafficking. And if you don't think that that's important, you actually have one here in your humble little town that we can talk about later on if you're interested.
Okay.
Yeah, the board's aware.
Okay. Yeah, we actually shut down 18 in one day in Framingham once we figured out what was going on. And they popped up one at a time coming back, but we keep slapping them down.
You're right, they do keep, in my business, it's part of what we see at times, unfortunately, and
I have yet to see
Yeah.
even a small town like this where that's not a problem. So. All right, so the other things we do is we offer a legal handbook, which I have rewritten this year during COVID because I had nothing else to do for the past 2 years. And it's now about 200 pages long. When I started it, our last edition was just over 100 pages, so there's lots of new stuff in there. If you haven't seen it yet, it's available. We usually charge, I think, around $300 or $400, but for our members this year, we decided to put it up for free. After everything everyone's been through, we might as well give back something to the membership.
thank you.
So, you're welcome. So we should be on, let's see here. Next slide, please. Okay, so we've helped a lot of local boards with cease and desist orders, with consulting with your town council on a variety of public health issues. Our executive director, Cheryl Sabara, has been dealing with tobacco control for decades. You probably know her, and if you don't, I'm sure you know.
We've
Okay.
met.
And on many occasions. So, and we've written over 30 guidance documents during the COVID crisis. And I know that Delshawn has seen several of those over the past couple of years. Next slide, please. So the public health law, the federal agencies set what are known as minimum standards. And the state law over and above that sets a lot of parameters around those standards. But you as a Board of Health are actually the ones that can make reasonable health regulations. The legislature delegated the authority to make reasonable health regulations, has been continuing to do that over decades. And public health protections are considered to be police powers, and they come before individual freedoms. And that's created some very interesting times, especially for boards of health in the last several months. In the last 2 weeks, we've seen 3 health directors in Massachusetts who have gotten to the point where they've had enough and left their jobs. We've had, one was after Cheryl and I actually did a presentation in front of one board, one of the board members decided that he was not content just attacking us verbally, but he actually wanted to take it out to the parking lot. That's how bad things get. We have a health director on Martha's Vineyard who had a death threat, and she cracked under that pressure, understandably, when she found 2 bullet casings in a bag that she brought home that was sitting on her desk for a couple of days. And that's how bad it's getting across the state. We have health directors who over the past couple of years have quit because of death threats to their children. I know where your kid goes to school. Little Tommy's adorable. Can you imagine what life would be without? And things like that. This is what has been going on in Massachusetts, I hate to say it, for the past about year or so. Next slide, please. And also, we should also take a second to understand that public health comes before individual freedoms. And there is a Supreme Court of the United States case on point, which goes back to 1905 smallpox vaccination, and it's called Jacobson versus Massachusetts, and that was where the Supreme Court said that states can mandate vaccinations for people to stop the spread of disease, and that starts with the local Board of Health. So, as we saw in COVID, the state can impose regulations, but you, if you feel that something needs to be stronger than what the state law is, as a Board of Health, you can't get lighter than the state law, but you can be more restrictive than the state law. That's what you just released just now, was a mask mandate that actually exceeds the bounds of the current state regulations and state law, which you actually put in place, and when you put it in place, it was still over and above what the state law said. So that's a perfect, wonderful example of what a Board of Health can do over and above what the state law is. Next slide, please. Okay, now, we live in Chapter 111. This is where boards of health. Chapter 111, Section 30 allows us to make reasonable health regulations. And these sections here we're going to talk a little bit about as we go through right now. We can address nuisances, we make trash regulations. It's up to you to take whatever steps you think are necessary to protect against nuisances, and one of which is disease spread, and that's sections 122 and 123. That's where you get the power to say that people have to wear masks. That's where you get the power to say that that vaccinations are mandatory for your schools and your town. And if you wanted to go over and above what the state had, you could do it couched in those statutes right there. There's a bunch of other ones there which we're going to talk about in a couple of seconds. If you could advance the slide, please. Now, this was a case where a private club was challenging a Board of Health on whether or not the Board of Health could have a smoking regulation in the private club. And in fact, the SJC held that a Board of Health can regulate even a private club when it comes to tobacco. In Framingham, what we did, Framingham was the first town in Massachusetts, actually the first town in America to enact a workplace smoking ban. And I served 14 years on that board, and 8 of which were as chair. Talk about enough is enough. But in Framingham, what happened was we were tightening up on our smoking regulation, dealing with restaurants at one point, and the workers in the private clubs came to the Board of Health. And we have about 6 private clubs in Framingham, Elks Clubs, Eagles, things of that sort. And they came to the Board of Health and they asked us, the workers asked us to please impose a smoking ban, because by shutting down smoking in all of the bars and restaurants, we were forcing everybody into the clubs. And the people that were working there were getting sick, and they couldn't just deal with it. So that came after this case, and once we started working on that, of course we heard from the club management saying you can't touch us, and we pointed out that, and this is the case to let you do that. So if you want to move on to the next slide. Okay, so we have also within the ambit of Chapter 111, there's noisome and offensive trades, and we're going to talk about that in a second. But let me just say that a noisome trade, it sounds like noisy, something that's noisy, but it's not necessarily that. A noisome trade, the classic case is a piggery. For everybody who wants a BLT, somebody has to smell a pig. That's just an unfortunate fact of life. So I noticed when I was coming down, there's a concrete plant on the other side of the highway. The people who live around that, if they wanted to make a big deal of it and go to the Board of Health and say that that was creating a nuisance, they could actually shut that down. We did that also in Framingham. We had a concrete plant that was opening up. They were starting to build the plant right next door to a car wash. And the car wash owner said, what am I going to do with this dust when cars are coming out of the car wash wet? They're going to pick up the dust. We went through a series of public hearings on that, and under the noisome trade laws, we actually prevented them from keeping going with their construction and shut them down before they got there. So that's really one of the more fascinating powers that you have, because you can actually sighting of something. You can look at an auto paint shop, hazmat storage, concrete plants, piggeries, things like that, where it might affect a neighbor. If it affects a neighbor and the neighbor comes to you, you have nuisance jurisdiction to say that you can't have it there. Now, if it's a business and they say, we need to be in this general location, you can look for part of town, and you can suggest to that business that maybe they might want to buy something in a different part of town than in the middle of a neighborhood. And that's your right as the Board of Health under the site assignment statutes. I had numbers on these slides, and I don't know what happened to them. but-
This is number 10.
Oh, okay. Oh, geez, we're even doing better. All right. So, okay, if somebody wants to go to court and challenge anything you do, you can make any health regulation that you want to make as long as it is reasonably grounded. And if you have had a hearing, and if you've heard both sides of the story, and if you've decided that the public health demands that we do X, and somebody comes and says, I'm going to sue you over that, if you have considered all of the public health aspects of that, you will never be overturned. There's never been a case of a reasonable health regulation in Massachusetts that's ever been overturned by a court. So as long as you take your time and are very deliberate about what you're doing, you will always be able to make that regulation. Okay, so, and the courts will approve, will assume that it's valid unless a challenger can prove on the record that there's no conceivable way that the regulation will protect even one person from harm. So that's a pretty high burden for somebody to challenge you with, because if one person could be affected by it, you win. And that's the way the courts are in Massachusetts. Next slide, please. This is an interesting case. United Comb is a company that moved into a neighborhood. It was a warehouse, and they moved into the warehouse, and they had a loading dock down one side, and they had a loading dock on the front. And unfortunately, across the street from that loading dock were residences. And United Comb is a plastics company, and they would receive shipments at 2 o'clock in the morning. Whenever the truck got there, the truck would back up and unload. Backing up a truck, you have the backup signal, you have the headlights going into the living room or into the bedrooms of the houses across the street. You have the trucks idling and running until somebody comes from home at 2 in the morning to unlock the place for them to do their offload. So you get that truck idling for an hour sometimes. So the neighbors said to the Board of Health, that is a nuisance. And the Board of Health said, you're right. And what the Board of Health did was it gave them restricted hours that they could not go beyond certain hours. And they gave them 7 days a week, even Sundays they could make their deliveries, but during certain hours. And the company challenged that and went to court, and the judge said, I think that's a little unreasonable. This is a company, it's a corporation, we've got to make sure that business is flowing, and stretch the hours by a few hours each way so they could start a little earlier and they could go till midnight, 7 days a week. And so the Board of Health challenged that court decision, and the higher court said, the Board of Health, you cannot set aside a Board of Health regulation that's like that because it makes sense and it affects somebody's rights, and it is in fact a nuisance to have that sound. So even in the face of a decision against the Board of Health, when the Board of Health appealed it, the court came back and found in their favor. So, nuisance, next slide please. Nuisance, there's perhaps no more impenetrable jungle in the entire law than that which sounds in the word nuisance. Okay, so nuisance, this is where when all else fails and you can't figure out how to shut something down, how to stop somebody, how to slow down any kind of a situation in town, look to the nuisance statute. You will always find a way to do it in the statute. Because what the nuisance says is that you have exclusive jurisdiction. This is where disease spread stops, where filth stops, and where any source of a nuisance, sound, and all of those other things, this is your jurisdiction as a Board of Health. The Board of Selectmen don't have this jurisdiction. Your town manager doesn't have this jurisdiction. It happens in this room. And so, and that again, we've seen nothing but nuisance over the past 2 years with the masking and all of that. A great example was back when masking began on Nantucket. I got a call from the health director in Nantucket. Roberto called me up. Roberto Santa Maria called me up, and he said that we're having a problem. We have a store where they have a line with no distancing, and nobody has to wear masks in line because the store told them they don't have to, and the store refuses to enforce our mask mandate indoors. What he did next was, after we had a little conversation, he went over to the store, and he had a ticket in hand, and he counted 10 customers in the store, and he wrote out a $10,000 fine and handed it to the store manager. He said, if you want to appeal this, if you want to pay this, it's payable now. If you want to appeal it, come to the Board of Health. And when they went to the Board of Health, it was $1,000 per occurrence. There were 10 people in the store not wearing masks, and he gave out a $10,000 fine. And that caught their attention real quick. They worked it out, of course, in front of the Board of Health. The store didn't have to pay $10,000. I went down to, I'm doing the Public Health Excellence Grant that we're going to try to bring to you guys next. We'll talk about that another time. But I administered the grant on the islands, and I walked in during the week between Christmas and New Year's. I went to the islands for that week because I figured nobody's doing anything, so it's a great time to just sit and chat with all of the health directors. And I went into a restaurant with my wife, the Black Dog Tavern in Vineyard Haven, and the waitress lifted up her mask, sneezed on her hand, put the mask down, and went and grabbed my soup from it was an open kitchen, grabbed my soup and put it in front of me, and I started to walk out at that point, and then I realized that nobody in the kitchen was wearing masks. So I called the manager over, and I said, nobody's wearing masks there. The waitress, I told him the story, and the manager said, I don't know what to do about it. I said, well, and I took pictures, and I said, I've just texted these pictures to the health director for your town. You'll probably hear from her tomorrow. And up until last Friday, this is the week between Christmas and New Year's, there was a red banner, if you Googled Black Dog Tavern, there was a red banner that said temporarily closed, because they got into it with the health director, and they said, we're not going to make people wear masks, and she said, well, I'll just take your license away. You can't serve food here. So that's all within the power. To do that, though, I'll skip a slide right now. To do that, your health director can do that, but has to report to you within 2 days that she's taken an action like that. And then if they ask for a hearing, you have to give them a hearing within that 2 days. So, are we on slide 13?
We will be.
Beautiful.
We're on slide 13.
Okay. So, in fact, we can probably pretty much skip through this because I just kind of get this. The exception, though, on a nuisance is farming. If you have agriculture, if you have a farm, a working farm, and they're driving down the street and they've got a horse-drawn cart that's poops falling all over the street, you can't do anything about that. That's not a nuisance because there are exceptions for agriculture under the law of Massachusetts. So, we're on 13, is that where we are?
Yep.
Okay. So instead of the whole text, I'm going to blow right through it. We're going to go to number 14. And this is where we talked about the noisome trades and the site assignments. And for instance, we did a site assignment on an auto paint shop that Herb Chambers wanted to open up in Framingham, and they went away. They said they weren't going to buck the order from the Board of Health on that. We also prevented Partners Healthcare from opening a clinic in Framingham where they were going to do day procedures, because if they opened their clinic, that was the only profitable part of the Framingham Union Hospital was the day clinics. They were losing, hemorrhaging millions of dollars because of free care and all of that. And if that center opened up, they would have put the Framingham Union Hospital out of business. So we did a whole statistical analysis. We did 6 public hearings on that. We had the CEO of Partners come in. We had the CEO from our hospital come in. And we determined that they could not open there under a site assignment. We used a site assignment to block that. So these are things you've got to think about that may not fit in the box, but you can only step outside the box if it fits in somehow. So let's go to number 15. All of this is true except if there is preemption. And preemption would be, for instance, years ago we used to do massage parlor regulations. Now the state has taken that away, and they say state does it, boards of health don't. That's how you got your body works establishments, the sex trade places, because you no longer could inspect massage parlors, so somebody got invented and said, we're going to open these things called body works establishments. So that was preemption. You can't stop a cell tower in your town because that's federally preempted on health grounds. You can stop it for other grounds, but you can't say that this could affect the health of somebody by putting a whole bunch of antennas on it. And I think we all know that that's just baloney, that a whole bunch of towers, a whole bunch of antennas on a tower do cause microwave radiation issues and all of that, but we can't challenge them as boards of health because the federal government said we can't. So, okay, move on. Thank you. Okay, so then you have to look at if it's going to be fair and reasonable, if it's going to be effective. The example that Cheryl always uses when she gives this pitch is she talks about how the Brookline Board of Health years ago wanted to outlaw the use of cell phones in automobiles because it was creating a hazard. People were getting killed and run over by people not being attentive. And in fact, they couldn't do it because the enforcement would have been people on the Board of Health and your health inspectors having blue lights on their car and pulling people over for talking on the phone. That doesn't work. But the state decided we're going to do something about it. And I think that Brookline looked at it, showed how frustrated boards of health were with what was going on with that issue. So you have to really weigh and balance. If it's not going to be effective, and if it's too burdensome, it's probably not going to be fair and reasonable, so you don't bother to pass that regulation. Next one, please. There's always a balancing test. I think you went backwards. So just because you can do something doesn't mean that you should do it. You can go on. And let's look now at what it is that you are responsible for doing as a Board of Health. Next slide, please. This appears on our MAHB webpage. Next slide. And these are 52 statutory and state regulation controlled activities that boards of health are responsible for. It's more than doing restaurants and more than looking at whether the trash is falling out of the receptacle. Next one, please. And I'm not going to go through every one of these with you, I promise, because I know that my time is precious here. And then what number are we on?
Now we're on 22.
Okay, keep going. Okay, yeah, 23. All right, so here's two statutes. One of them, if the first one, Section 102B, if your town adopts this statute, and if you have over 5,000 inhabitants, then you must employ a health inspector in your town. And that could be your health agent, it could be your director, as long as you have somebody doing inspections. And then the next one is that just another statute that basically says that you can appoint an agent because technically speaking, you guys are the ones that could go into a restaurant and do the inspections. You guys are the ones that can enforce it, because you do enforce all of these. Delshon is your agent, and so as your agent, she makes it so that you don't have to do that. Now, I know, because I do a little research about places before I go to them, and I've seen some of your meetings on some of the videos, and I know that there was an issue about, this goes back to, I think, last summer, that Delshon was alone in the office and had to leave the office and had to go do something, which meant closing the office. And I know that you, ma'am, Cecilia, you made an issue of the fact that she couldn't do that. Now, the proper procedure would have been for Delshon to call the chair and tell the chair, I need to go out, so one of the board members can either go out and deal with this emergency, which you're not equipped to do because you don't know how to do what she knows how to do, or one of the board members would have to come into the office and sit there while she goes out and does her business for the Board of Health. That's how that would have to be done. Or she could run out of the office and leave a sign on saying, I'll be back in an hour. But she's your agent, and you technically are directing everything that she's doing, and you technically, you're not equipped to do it. Like I said, you wouldn't know how to do a HACCP order or something like that if you walked into a restaurant. She does. That's why you have her as your agent. But she is your agent, and that's important to understand. slide, please. Okay, so basically, all of this mumbo jumbo comes down to the fact that as a Board of Health, you are about compliance and not punishment. You just want people to comply. Nobody wants to hand out that $1,000 fine. People just don't want to do it. Although, we did so, another instance from Framingham, you remember when they were doing the learning pods at home? There'd be like 5 kids would get together in someone's house, and there'd be a tutor that would come over. We had a tutor that was doing 3 houses a day, and she tested positive, and she continued doing 3 houses a day with 5 kids in each house. She knew she was positive. She was sick as a dog. She looked like she was going to die, and she refused to tell the health agent anything about who she was going to see. She wouldn't assist in any contact tracing whatsoever, and she continued going house to house to house to house. And as a nurse, that probably kills you. It killed our nurses, I'll tell you. And so the only way around that was to have the police follow her, write down the addresses where she is, go to the health agent found out who was in that house, notified them. Think of the time that had to take a ridiculously busy time when the numbers were way up here. And so the only way to crack that was to hand her $15,000 worth of fines. And she immediately decided, I'm going to get into bed and be sick and stop this nonsense. Everything got dropped when she fessed up and helped out. You may have seen it here with your hockey dads. The hockey team got sick and the coach and the dads refused. Did that happen in your time? I think it did.
It sure did.
Yes, and the coach wouldn't tell Delshon who the hockey players, who the roster was, and somebody was sick on the team. Okay, keep going. I don't want to take all my hair. So, what number were we on?
25?
Okay, thank you. So,
Would it help, Mike, if you just did this?
no,
I could put it over
that's
there.
fine, that's fine. I'm all right. I'm almost done. So, well, you've seen the slide, so we can move on to the next one. That's fine. Okay, so you appoint the agent, and you have to make sure that your health department has the budget that it needs. And the problem that everybody has, and I remember I used to do what you do, and I used to go to town meeting and ask them for money. And if you have a good health department, and you have a good health department in this town, if you have a good health department and it's doing its job, it's hard to ask for money because they don't know what you're doing. They think you're doing nothing. It's when the stuff hits the fan that people understand what you do. So as long as things are running smoothly, it's very difficult to ask the town for money. But that's all up to you. You employ her. I looked at your charter here in this town. She's your agent. She's not hired by the selectmen or by the town manager. She's your hire. So some towns have it that way, some towns don't. Move on, please. And we are at number
27.
27. Okay. So, all right. So a couple of things. It should actually not be Abington on the bottom. I'm sorry, I didn't see that till right now. I may have used the slide deck before. Okay, so let's talk about the agenda issue for a second right now. The agenda is yours. You're the chair. You control the agenda. If a Board of Health member wants something on the agenda, they come to you. If you think it's the right thing to do, you put it on. And there are chairs that don't put it on when it probably should have been. At that point, the other board member who asked you to put something on can bring it to the next board meeting and ask for it to be put on, and then there's a vote. So you can be outvoted 2-1 if you don't want to put something on the agenda, but it's your agenda. You're the chair. It's up to you to make sure stuff gets on there. Okay, so let's move on to number 28. And let's talk about liability, and I'm going to crash through these real fast because there's a lot of, in fact, I'm just going to talk and we're going to skip through a whole bunch. If the town gets sued for something that one of you does or that Delshon does as your agent, the maximum liability is $100,000. You as members of the Board of Health, even though you direct her, you're not personally liable. She's not personally liable. as long as she does, as long as she acts within the scope of her duty, within what a health director is supposed to be doing, then there's no liability to go to her. The town would have to pay if they got sued, and if the jury said $1 million for whatever it was, the town would have to pay $100,000. It's a cap by statute. Next slide, please. And basically, the town is a public employer. You are considered public employees because you are elected to a position in your town or appointed. I think you're elected here. And so you are considered legally public employees. Next one, please. And these are the three prongs of the test that determine whether or not you are liable for some money over and above. If you step outside your role, if you do something intentional or something idiotic that no Board of Health member should be doing, then you could be personally liable at that point. As long as you're staying within your scope as a Board of Health member and you get sued, the town will indemnify you. You don't have to pay anything out of your pocket. There are instances where people go a little crazy, they lose their temper and they do something bad and maybe get into something with somebody in a store or something and they say, I'm on the Board of Health, you have to put your mask on, and somebody grabs you and then you punch them and they smash their head and they're in the hospital for a month. That's not covered. Even though it started that way, it's not covered.
Don't punch anybody.
Don't punch anybody.
All right.
I'll try not to.
Right. So, next one, please. Okay, and we're at 20.
Sad to say it
21.
happens.
We're at 31, you said?
Yeah.
Oh, wonderful, okay, good. Good. All right, so these are what public employees are. We already covered that, so go right on. And this is basically what I just told you. It's that they look at the facts, the individual facts of each case to determine whether or not you're within the scope of your duty. Next one, please. And, okay, as long as you're not stepping outside, we already did that. Okay, so if you're on call, you're not on duty at that time. So, Delshawn, when you're sitting at home waiting for the phone to ring on a Saturday night because somebody's done something wrong, you can be irresponsible. You're not working for the town at that point. But as soon as you get the call and you're on your way to that restaurant because something's happening, you are then protected by this law. Okay. Next, please. And yeah, you don't want to violate somebody's civil rights and things of that sort. That's way outside the scope of your employment. Next one. Okay, so now let's talk for a second about what's one of the most confusing things in the law, which is discretionary function. If you have discretion to do something or not, and it's within your job description that you have discretion to make a decision one way or another, and you decide not to do it, you can't be held liable for that decision. So the next slide, actually the next one after that, I think. Okay, this is a case where somebody decided that they weren't going to put a fence or shovel stairs in a playground. The kid fell down and the kid died. Okay, now the decision to not shovel was motivated by the fact that there was no budget, there was no money available to take care of that still part of the park. So somebody said, we're not going to bother to shovel these stairs because we just don't have the funding for it. Unfortunately, somebody died when that happened, and the city of Lynn got off with it because it was a discretionary act by somebody in charge that said, all things considered, we just can't do everything. Because you can't do everything. You can't make everything 100% safe. And so if you have discretion, and even if you make the wrong decision, and you have a terrible result like that, there's still no liability. So that shows how strong the law is that protects what you're doing here. Next, please. Okay, now, failure to inspect. There is no liability if you don't inspect something and something goes wrong. Somebody can't come before you and say, you should have inspected that. Why didn't you? So-and-so got really sick, and we're suing you. There's no liability for not inspecting. If somebody comes to you and says, there's a problem at such and such a restaurant, you need to go there, that's when you have to leave the office and go to the restaurant, because then you're on notice, and then you have liability if you don't act at that point. Okay? Next. And we're number which?
39.
Okay. Okay, so we are almost there. So there's no liability for any vaccinations that are given. There's several laws that protect, and this is very important for the nurse to know. First of all, under the pandemic laws that came down in Massachusetts, the governor signed an emergency bill that came through saying that no matter what happens, if you're giving a COVID vaccination and somebody dies from the vaccination, no matter what happens, there's no liability on the part of anybody. And then the Public Readiness Emergency Preparedness Act says the same thing, but even more strong than that is the National Vaccine Compensation Program, which says that no doctor or nurse or hospital or clinic or anybody who's administering a vaccination under a public health program can be held liable, and the manufacturer of the vaccine, unless they know that there's something wrong with that particular lot and they put it on the market, the manufacturer of that vaccine is scot-free. It's complete total immunity from liability. And in fact, if you have a severe vaccine reaction, there's a compensation system set up, and you actually go to court in Washington. It's a special court for vaccine injuries. And you file a case there, and you're compensated. So there's no liability at all for vaccinations, and we're almost done. One more slide, please. Let's talk real quickly about, this is the last slide, I promise. These are a couple of very, very important things for you to know about. First of all, you cannot meet and talk about anything when you have a quorum, which is two of you. So two of you can't talk about anything that you might be deliberating about. At no time can two of you have a conversation about any Board of Health business, essentially, at all.
We can't deliberate on it.
You can't deliberate. You can't even talk about, like, this is what I might want to do when it gets in front of us. You can't have those decisions. And in fact, it's so absurd that we went to 5 members in Framingham because we had a mercury spill, and it was in a school, and I was called in because it had to be signed off by the chair of the board to close that school for the next day while DEP came in. I could not call the physician member of the board to talk to him about mercury poisoning and what the threshold levels are and whether or not we have too much here, because that was something that was likely that we were going to have to vote on within the next 2 days under an emergency meeting if the school didn't get cleaned up that night, which it didn't. But I couldn't even call the physician member of the board to talk about something under that circumstance. That's how strong the open meeting law is, because we had a likelihood that we were going to be deliberating on something. You could talk about things like, can we meet 3 o'clock in the afternoon, blah, 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 or if you're at a party and you run into one another, it doesn't say that you have to stay away from each other. It just says you can't talk about anything that you might deliberate on. You can talk about stuff you did deliberate on if there's no chance that it's going to come up again in the future. But you can't talk about stuff that's going to come up on one of your agendas. And that's very, very important to know. And another thing is social media. And this is a trend.
Maybe ask one question before you jump to social media. So for example, I want to make sure, because this sounds a little bit different than what we were told by town council.
Okay.
At least that's my impression. So let's say I went to one of the 2 members and said, I'm thinking of bringing up there's an issue with whatever business, private home, whatever. I'm thinking of bringing this up. What do you we think about what should we bring this up? Am I allowed to do that?
No, you are allowed to do that.
Okay.
Yeah, that's ministerial housekeeping stuff.
All right.
But you can't say, I want to bring this up because the guy's house is a mess and the neighbors can smell it, and it's creating a nuisance, and I think we have to do a nuisance hearing on that. Then you've gone too far. But you could say...
So describing it goes too far.
Right, well, because you're talking about why you might vote in favor of condemning something at that point. Okay? you're kind of influencing the decision now. You could say, we need to talk about 606 Main Street at our next meeting because there's some issues with the neighbors and smell or hoarding or whatever. And you can go that far, but you can't go into anything that might tip your hand as to how you might want to deliver a recommendation. So you know that totally, and always go with town council over us.
Yeah.
Always, 100% of the time. So, all right. So, but social media it's a trap, and it's very dangerous because if the three of you, I think that you have a town Facebook page.
Yeah.
Okay. So if somebody posts something on the town Facebook page, you know the other two are going to be reading it. You know that all three of you are likely to read it. And if two of you have read something that talks about Board of Health business, that's something that may be deliberated on in the future, then that could be an open meeting violation. And that's the easiest trap to fall into, because you see somebody write something about the mask mandate, and your natural instinct is you want to get in there and you want to defend yourself. You want to say, we had to do that because blah, 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 and now you're teetering right on the line of potential violation. So that's an important, very important thing. The other thing to keep in mind is that if you're sitting here and somebody texts you, and somebody's watching it on TV, that text, they can make a request if they see you doing something, right now you belong to the public as you're sitting at that table. And anything you do belongs to the public. So if you're texting someone, somebody can actually make a request, and it happened in Framingham. Again, I'm sorry to use Framingham all the time, but if something go wrong, it's going to go wrong in Framingham. It happened in Framingham, and the mayor was texting the town COO, and you may have seen this, I think it was picked up by the Globe. And the string that was requested, the mayor was talking about a city councilor during the city council meeting, and she was communicating with the COO by text, and she called one of the city councilors a part of a body, and that came out all over the place because it was requested and it was turned over. So any texts, anything that you're doing when you're on company time, when you are acting within the scope of your duty as a Board of Health member, that's all discoverable. And in that same one that I watched, a gentleman came and gave you pictures of a house. I think it was the house.
Yeah.
Okay, and you had the pictures on the table, and that was fine. But what you should have done in that instance is handed them to Delshawn. She should have run into the office and made a photocopy and then given them back to you. Because when the guy came up and took them back from you, that creates a public records law violation.
Oh.
Anything
Okay.
you look at, anything
All right.
you consider, anything at all that somebody puts in front of you. You know, I can't take, well, I've given this to you anyway, but this is part of your record. And somebody can request a copy of the slideshow, the same way that they could request anything else that happens in an open session. So always make sure that anything that you look at and consider for your decisions, make sure that gets put into the record, into your minutes or something. Or
Good to know. Thank you.
Okay. And then I think that is it. You know, if there are any questions, I think the next slide says thank you or something like that. Yes. So there.
So I do have some questions.
Okay.
So you mentioned nuisance, and the board has the power to stop things or whatever. Would a 40B be something that we could prevent? Because I was asked that question by a resident, asked if I had powers, so they want to build a 4-story apartment complex in Rockland. It's a 40B. Residents aren't happy. I've gotten requests if there's anything I can do as far as...
If it's going to create a nuisance, or if it's going to violate any kind of your ordinances or your bylaws of your town, but particularly if it's going to be a nuisance, if it's going to strain I don't know what they're gonna be doing for water supply.
I was about to
Yeah.
say, stringing the
String-
water
water
supply
supply,
with the rest of the
sewer.
Sewer
infrastructure.
supply,
That
That,
could be
well,
considered a nuisance?
if you could find that as a nuisance somehow, and we could talk about that.
I'd love to entertain you on that, yeah,
Yeah.
absolutely.
Yeah, I mean, I can, but I'll probably be able to give you some questions you can ask your town council.
Okay,
So,
That would be great, yeah.
I don't wanna get into
No.
anything like that at all. We're not here to second guess anybody.
Yeah.
But, yeah, if you can, we had a 40, somebody wanted to build 40 homes on this big tract of land in the agricultural part of Framingham. And they wanted to do septic systems for each of the homes, but they couldn't be separated by enough space in that room to have, in that lot, to have 40 septic systems with wells, because they needed wells, there's no town water in that part of town. There just wasn't the room to do it. So the Board of Health stopped it, and it's actually an appeals court of Massachusetts case called Nexum Development versus Framingham, which we told the developer that you're pulling too much water for those houses. It was in a part of town that's on bedrock, and the other homes in the area are so strained for water in the summertime that there's one homeowner actually schedules 2 weeks away from home in August, knowing he's not going to have water.
oh my
And every
gosh.
year he goes to the Cape, that's when he takes his vacation. And they wanted to put 40 homes on that piece of property. And so we said that you have to run a pump test in the month of August. You have to show us that you can draw the water for 40 houses in the month of August on this property. And the guy took that to court, and the appeals court of Massachusetts said it's a completely reasonable, totally reasonable demand by the Board of Health. And he could never do it. He could never establish it, because he knew that the minute if he pumped it up for 5 houses, it would have dried up everyone else's, because of the bedrock feature there. So there's all of those considerations. I think if you're talking about costs, sewer hookup costs and things like that, that's not.
It's gotta be an issue for, what is it, like a moratorium right now. We have a moratorium on sewer connections.
Okay, because it's going to overrun your sewer system.
Yeah, I'm not like 100% knowledgeable on it. I know that a resident asked, but I will reach out to
We'll talk.
Sue, we'll talk.
We'll talk.
All right.
Okay.
Gosh, this is
I
good.
do have another question for you. So going forward, in 2 months, there'll be a new board member on here. And then, every year, the possibility of somebody new, coming on. How can we get this type of presentation and this sort of education for new members going forward?
Okay, so we're going back to real life, I hope, real soon.
Hopefully.
And one of the things that MAHB does is we have these certificate programs, and it's an all-day program. The closest one to here is in Taunton. Yeah, it's Taunton, Marlboro, and Northampton is where we do them. And send your new member to that when we do it. But if you want something, well, first of all, you have the recording.
Yeah.
Yeah.
But if you want Cheryl or I to come out here, we go to boards of health just like that. Anything that you want. If you want to talk more about the open meeting and the public records aspect and all of that, we're happy to. We have a whole separate dog and pony show on that. But we're always happy to, and always available. You guys are our members. Always available. Belshon will tell you. That's my cell phone. And any time that anybody wants to call me. I don't have a life. I don't have a
Well,
life.
now that you broadcast it on the RPS, everybody knows your number.
My 3 kids have grown up, they've had enough
Yeah.
of me, they all live elsewhere. My wife teaches, so, we don't have a life, so whatever you need, seriously, I want to make sure that.
Appreciate it. Thank you.
Thank
Any
you.
other,
I've
questions?
got more questions. Does anybody on that 40B? Everybody's
Not
there?
on the 40B.
All right, so you spoke about discretion and failure to inspect. Now, as a health agent, if there's a property that is not, it's kind of falling down, and I've sent them letters, neighbors complained, but they will not give me
Access.
Okay, so that's when you go, you talk to your town council, and you yourself can go to the district court and meet with the clerk and get an administrative search warrant.
And that costs money.
No, it costs you time going to the court.
Well, town council would have to do that, correct?
No, you do it.
Okay,
We'll talk you through it.
okay. You'll talk me through it?
Yep, yep. Cheryl or me,
Okay.
we'll get you through that.
Excellent.
Thank you.
Yeah, and that's also true with eviction issues. You can get in, you can't go in with the fire department and police department. That you can't do. You're not allowed to just go in because they do. If there's a public health issue, then you can. It's better to be invited in.
Yeah.
What we did with our, we had a social worker who was working on hoarding, and we assigned her to the fire department. Because it's always the fire department that finds these situations. And the straw that broke the camel's back, of course, was the pile of stuff in the hallway that was so high that they couldn't get the gurney through to the bedroom, and they had to break a window and hand the guy
Oh,
through the window.
I've come across quite a few of those. I'm retired from the fire department.
So you know exactly what I'm talking
Yeah.
about. So it made sense for us to send Framingham has like 3 full-time social workers, and there was one that deals with hoarding and with housing issues. And it just made sense to have her be able to roll out with the ambulances, especially on known properties. Because you knew when you were going someplace.
Oh, yeah.
Yeah, so,
Yeah.
And
Running
that
through the list
does
in my head right now.
yeah. Yeah.
And it does happen. I've gotten calls before, and, on my way, they say, we've got to take the person, so they're not going to give you entry. So then you follow up with that person, and they just don't want.
We had a lady with 19 dogs in one room at the Red Roof Inn off the Mass Pike. And she was living in this room, and she was raising dogs, and she had 19 dogs,
Oh, my gosh.
and she was having chest pains, and she called an ambulance. The ambulance showed up, and there's dogs of all sizes and ages, because she's breeding the dogs in a hotel room for sale. That's how she was supporting herself.
How did that
Inbred, I
happen?
might add. All those dogs unfortunately had to be put down. But our health inspector stopped at the door. Police and fire went in, the health inspector stopped at the door. But she could see everything she needed to see. It was just a hotel room. But there were 19 dogs in a Red Roof Inn room. That's crazy. But you can't go into a situation like that unless you're invited.
That's correct.
Or have a warrant.
That's correct.
And the warrant will teach you how to do it. It's very easy.
And then, so you were talking about the 19 dogs. We had 64 cats. Yeah.
One cat's too much for me. I'm sorry, I'm a dog guy.
So, all right, so I just wanted to touch on the discretion and the failure to inspect
Okay.
aspect of it. And that was all my questions.
Okay. Very good.
Thank you very much.
Thank you.
Thank you.
Really appreciate your time.
All right.
Very informative.
I'm
Yeah.
glad
Oh, I just actually have a quick question. Do you know when those classes are going to be starting up again?
You're asking the same question that the DPH is asking us right now. When you know, actually, it's very interesting, if I could for a second. You know that these grants are out there for public health excellence grants, where you're supposed to be able to connect with towns in your area. I was putting together a grant for this. Well, I did all of Plymouth and Bristol County for the latest round, and your grant group fell apart because a couple of the towns decided they just didn't want to do it. It seemed like too much work for them or something. Even though part of it is to hire a grant manager, so that the health directors don't even have to touch it. I'm trying right now. I promised Delshon the day that your group fell apart, I swore that I was going to get you guys into something. I'm working with 2 different grant groups right now and want to get you into that. But where this is all headed is that it's shared resources, so that you'd share a nurse, you'd share maybe a social worker, share an inspector with 5 or 6 other towns. It's not enough, but it would take one item off the plate, like you could have this nurse in charge of setting up regional clinics. The health inspector might do low risk or high risk or whatever food inspections. Take that item off of all of the inspectors across the area. Social worker would be working on things like substance use disorder, teen suicide, teen depression, aging issues. I think that you have, if I remember right when I was doing my homework, I think you have a pretty significant aging population in your town.
Yes.
And you have to be able to make sure that they're getting their meals and that they're getting their services and stuff. And that should be through the Board of Health in an ideal situation. So that's one grant program. That's called the Public Health Excellence Grant Program. But bigger and better than that is the $200 million that we were able to get from the legislature, from the ARPA funding to basically spend a lot of money on trainings, which is a long way of answering your question. We're going to be actually redesigning everything. But certifications, members of boards of health are going to have to go through some certifications now. There'll be money there to pay for Delshon's extra trainings, for your extra trainings, for certifications that your staff might want to have. I don't know if you have your license, if you have your certified pool operator.
I do.
Okay, I think you have quite a few of them.
Yes, yes.
But all of that is, we're trying to get everybody in Massachusetts to at least have some minimal standards. It was the, do you have the blueprint, have you ever seen the blueprint for local public health? If not, I'll send it, will you send it on to them?
Yeah, I think I gave everybody back in like May of 21, right?
Mhm.
Yeah, May of 21. Remember, I think they were big packets.
Okay,
right?
there's a, well, it's the report of the Special Commission on Local and Regional Health. And there's a 19-page executive summary that I'll
If you can
Yeah, no,
resend it, I'll send
you
it.
did send
Yeah,
that.
and,
Yeah.
and that calls for minimal competencies for everybody across the board, from inspectors to nurses to board members, so that everybody has at least some level of parity. The cities and towns that are going to get most of the money are places like this, not places like Boston, because Boston is a have. You guys are sort of a have-not when compared to Boston. And the idea is to rise everybody's boats to the same level, so that you don't look at Boston and say, I wish we had one of those, because you will. And if you don't have one full-time because you don't need one full-time,
This will share one.
that's what the sharing comes in.
Okay.
So it's a whole new thing that we're doing right now. But we have out of the $200 million, we have money for data, so that there'll be everything. I don't know if you're working on paper or if you're working on a tablet now with your inspections.
I'm working on paper.
Okay, you'll have tablets. You'll have all the software will be bought. The tablets will be bought by the state for you. So when you walk into a restaurant, you can pump, boom, 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 and you're done.
I
And
said to him, I was like, listen, this is not my fault that these people don't need it. I need it.
No, I know.
And I begged him.
Well, the problem is that the people that you are in with don't know what they don't know. Delshon knows what she doesn't know. She knows what she needs. But some of the other people, oh, you don't need that. You know. And I said, well, do you do all your restaurants twice a year? Did you do them this year twice a year? Well, no, we don't have time. Well, can we do them twice? Well, maybe not. Okay, so she knows what she needs. But that's not true with everybody. And so we're going to try to get you into one of those groups. I'm begging, and I want to be very careful that I don't put you in a group that you have to go through other towns to get to, because it should be contiguous. And there's two in the area that touch you. So, but that's all stuff to be. And like I said, here's my number. Call me, talk to me about it if you want. But we'll get you that executive summary to look at, and then you can see where it's going. And I'll send you the thing about the $200 million. The letter we wrote to the legislature asking for it.
Okay.
And for the grant program, they gave us $10 million for fiscal '21. They gave us $13 million for fiscal '22. And we said we've got to be careful. We don't want to break the system, so we asked for $13 million in this coming budget, and they came back and said you didn't ask for enough. You have to ask for $15 million. So when did you ever hear a senator?
Yeah.
So you didn't ask us for enough.
Right? Yeah.
That's awesome.
Right, so we have their attention, and it's a good time. It's a good time to be in public health right now, because
It is?
once you get, well, if you could take the bullet casings in stride, things
Yeah.
like that. But
The angeriness.
Well, if we can deal with the anger, it's right now the state wants to spend money. DPH has some amazing people that have come into the system recently. Our health director from Framingham actually is now the director of the Office of Local and Regional Health. sitting in that chair and wants to make that chair an easier place to be.
And he's a wonderful asset.
He's the best.
Yeah, absolutely.
So we're here for you, like I said, and MAHB is, our last name is Health Boards, so that's what we're here for.
Awesome. Thank you.
All right?
Thank you.
Thank you.
All right. Next on the agenda, hi Kathy.
Hi, how are you?
Public health nurse. Update.
So what would you like to know? What am I doing?
How's it been? Been a month?
So it's been a little over a month. So it's different, obviously. I'm used to being in the schools, 27 years. And so this is a little different. So I don't see, I miss the kids, so, but it, you know. So it's a new process for me, so I'm learning. And those two systems that, you know, I'm using, which is the MAVEN system, which is our data collection surveillance system, and then MIIS, which is the immunization. That MAVEN system is really hard to maneuver. It's just very difficult. So I'm learning, and again, I have to do it through the actual computer. So everything's online, and I've done a lot. I've cleared up a lot. I've done a lot on that program, but it is difficult. So I'm taking some time. So I do a lot of webinars. I went today. I went Thursday. So I'm doing a lot of that. But, and then obviously COVID went from when I started. All of a sudden we're down to 90. It's like crazy stuff. But again, there's other stuff that you're dealing with. It's not just COVID. So you
Right.
know, I'm dealing with other
There's other
issues. Yeah.
infectious
Yeah.
diseases that are still
out there.
still
Yeah.
pop up,
And
and
yeah.
you know.
Yeah, so every day I go on it, every day I'm on MAVEN, every morning. So, you know, I'm only on, you know, I work part-time, so it's perfect for me. I work in the morning, an hour in the afternoon, emails, you know.
And it's taken a huge lift off of my
Oh,
plate.
sure.
I mean, absolutely huge. Anytime anybody sends me to like Home Depot, I said, I'm going forward, can you send this information
and
to
they do.
Kathy Ryan?
And they do.
And they do. So it's really good, and she's dealing with like clusters that I don't have to deal with anymore. I bumped into Jean Blaney, and I'm like, oh, you don't call anymore. And she was like, well, I don't need you. I got Kathy.
Yeah.
Which
I do
is
love that.
amazing, and it's so helpful, and she's worth her price in gold. Like, I can't tell you, it's been nice.
Yeah, so I do a lot with the schools, like I was telling Christine. Since I've been in the school for 27 years, I'm still doing a lot with them, so I know how many cases they have, I know how many they're reporting to DESE, I know how many, you know, they have that new home program, the home testing program. I know on Mondays how many kids tested positive. The problem we have with that whole system that they're doing is that there's 2,300 kids in our system, and only 700 are participating. So when you see 7 or 8 kids testing positive on Monday, you're thinking, oh, that's not many. Well, it is. We had 7 or 8 when we had 2,300. So it's, you know, but the parents have been great. They call them up, they tell them, we've never had a problem with parents telling us, you know, who's positive and who's not. They do want to send sick kids to school, you know. So we have a lot of that, but, so I have access to all that. So, you know, and I deal with the preschool, the chipmunks.
Yeah.
They died and went to heaven. They love it because I talk to Jean every day and I talk to Olivia. And then I, you know, do a lot every day with the school. So this week we're on vacation, but I'm still dealing with preschool because they have the recreation programs that they're doing now for the kids, vacation programs. So I talk with her every day. So that's been working out pretty well, and that actually has been very good. And they call me and email me with everything. So, and I hear from the daycares once in a while, and Home Depot, like she said.
Yeah.
So.
Are you hearing anything from the senior community?
No, not at all. I do, so what I've been doing, because COVID, we don't have that many, and they're off of, by the time I get a hold of them, they're already off of quarantine, and they don't want to talk to me. So what I've done is, Delia and I talked, and I said, I got to send them something. So I went and I made like a fact sheet for isolation, for symptomatic and asymptomatic people, and also for close contacts. And I usually put a cover letter and send it to them. I was telling her, today I sent one to my nephew, because I got a call from Home Depot, but he tested positive like, I guess February 8th, and I'm just finding out about it now. It's February 22nd. But yet on MAVEN he never popped up, and he's still not popping up, which I thought was very interesting. So I sent him that information, just so he has it, you know, and they can, I mean, it's 4 pages, it's a lot of information, but it's good information. It talks about travel and masking, and it's really, I took it from CDC and the state, so that's something that I send out to everybody, no matter what.
And that will go on the website. I checked today, there's something totally different
Okay.
on the website.
Yeah, so Dylan and I talked, and I thought with when they're doing the home tests, they don't have this information
Right.
at all. They're
Right.
getting nothing, and we're not getting notified, because they're not calling us, and the state's not letting us know. So I thought if we put it on the website, that they can at least have that information, because I know that they're on your website, looking at different things. So they can put, you know, the isolation and the quarantine fact sheet up there, that way they have that information. So when they're doing their test, they test positive, they don't know who to call, they can at least go on there and get
Can
the
you get
information.
hard copies of that when we're giving out the free test kits at Town Hall? So they have
Yeah.
Oh, that's a good
That would be
idea.
a great idea.
them. So
Yeah.
as
Yes.
they're taking them,
Yeah, then I have like a little cover
What
letter.
else can I give them?
I have a little cover letter that when I send them, letting them know that the state has let us know, the Board of Health know that they were positive, and I give them the information, and if they have any questions, they can call me, email me, got like my own little numbers. I don't know my telephone number, but it's at the bottom on the paper, so.
Great.
But you know, before I was giving out tons of them, now I'm only giving out like 3 or 4 a day, but go to the post office every day, mail those letters.
Excellent.
So,
thank you. Is there anything we can do to help you?
no, so far so good. Like I said, Dellie's been great, Janine's been great. I'm getting me everything I needed, so it's just really learning, and that's what I'm doing. So
Yeah.
when I have my downtime, like this week, I'm doing, like I said, a lot of the webinars. I do a lot of.
They're so helpful though.
They are. I did one today at 3 o'clock.
I
I did
did
one
the
at
3
2
o'clock.
o'clock, 3 o'clock, and 11 o'clock. I do Maven, and I do the general Board of Health one. And then I've been doing DESI because I'm still involved. And that's one good thing I know in Rockland, because that I'm in the schools. Other towns, they don't have that luxury, so they don't know about their schools. Where I can tell you every number, I can tell you anything you want to know about those schools. So,
And from day one, we've worked together,
Yeah,
from the
COVID.
beginning through COVID.
yeah, so we've been working together for a year and a half, well, 2 years now.
Yeah.
We started back when it first started, so, you know. we've
Right,
been
when
doing
they
this for a
brought the
long time.
schools in and doing the athletics,
It's been a nightmare.
tracing, yeah, oh yeah.
Okay, good.
It's been a nightmare, but in the past. This is really good, so I'm hoping the trend stays. And when we have another variant, probably, I'm hoping things get better and better. We'll see.
Great. Awesome. Thank you.
You're
Anything
welcome.
else,
Thank
Kathy?
you. Thanks for being here.
Thank you.
All right. All right, next on the list is the dumpster guidelines, which we're still waiting from other departments,
Correct.
right? So I guess we can actually table that to the next meeting, and how many departments are we waiting?
Just one.
Maybe we can put a little pressure so we can make sure it's on this, the next,
Yeah.
for the March meeting.
Yep, I will have it ready
Yep.
in for the March, and before the March meeting.
I'll
And
leave
sent you.
you my draft. There's like 3 spacing errors and like a comma missing. It's
Okay.
major, just a couple things I picked up on it.
I love it.
To fix. So I guess, is there
So
anything
you're
else?
gonna do a motion to table?
Unless there's any discussion on it at all, or,
There was one thing, under temporary dumpster, we have the definition as a dumpster used temporarily only during the construction or renovation of a building. So what about somebody that has a temporary dumpster because they're cleaning out, they're doing a spring clean out?
So that's the kind of thing that if you email me that,
I mean,
like
I'd
when we
almost
went
consider that a
through that.
renovation.
Huh?
I almost can consider that a renovation.
Yeah,
Like a spring cleanup?
yeah.
You
Yeah.
consider that as part of like
I-
a renovation?
Yeah, I would.
If, it depends what kind of dumpster they have. Like if it's a construction demo, you can't put bulky items or house cleanouts when you're moving or whatever in the same dumpster as a demo dumpster. So the demo dumpster is for actual renovation, ripping out sheet rock or whatever. A clean-out dumpster is completely different than you're gonna put in like a mattress that you're throwing away an old dresser or anything like that. That's separate, so we could certainly look at that and have a discussion about that.
Well, yeah, that's the question, would those then be considered temporary dumpsters and exempt under the guidelines?
They would be considered exempt. Dumpster cleanouts?
Yes.
Yeah,
Okay.
like housing cleanouts and construction, yep. What was that under? What section?
It's the definition, so section 1.
Oh, definitions of,
Yes, it's maybe like just add in, during the construction, renovation, or somewhere add in
bulky,
disposal of large household
bulky
items.
items.
Bulky items, yeah.
Okay. Okay.
I think that was, again, I have a couple of small ones, but I can just give you the draft.
Okay.
When I leave, there was nothing major. That was it.
Okay. In that case, I guess I will entertain a motion to table it. So the next meeting.
Motion to table dumpster guidelines to the next meeting.
All right, I have a motion. Second?
Second.
Second, all in favor? Right. Unanimous? Next, well, last on the agenda is the health agent report.
Oh, I thought, I'm like, oh yeah, we're adjourning.
Well, make it fast if you will.
That's so fast. Yes, I know. So, office day update on January 26th. I met with Doug Lapp, town administrator, and Elizabeth Zelinski, former town accountant. I apologize for my typos because I was running out of time. So I met with them regarding the fiscal year 23 budget. This is done annually, and you'll notice from last March, I also met with them. It was later because of COVID on March 9th, and they gave that a presentation on increasing the trash fees or whatever. So I had the similar kind of meeting with them about the budget. So I know that back in August and September, we had low, I always say this wrong. Communities. So that is like the recycling communities, the prices of whatever fluctuate. We saw a price as low as $3.15 in October, and in December, it's back up to $35.25. So that is the reason why we need to keep the trash fees the same because of that fluctuating
Absolutely.
uncertainty rate. And I have given you guys copies of the budget for fiscal year 23. If you just want to review it, and if you have any questions, one main line item, and I never changed it, is the $12,000. I have a wish list, so I've requested an additional $12,000 line item to help with food inspections and Title V stuff. We didn't have that budgeted previously. Former board member was a certified Title V inspector and a licensed sanitarian, and we were able to use him. Without him now, it's all me, so I am looking into get my septic Title V certification. However, there is no classes, just like last year because of COVID. I'm hoping at some point this year there will be another course that I can attend, but if not, I've requested a $12,000. Again, that was an error on my health agent report, to help assist with food inspection in Title V. Many surrounding communities already have food inspectors that go out and inspect the restaurants. The last 2 years, it's been extremely helpful through CARES Act and all the grants that I got, able to hire somebody to go out and assist me on food inspections. That does not mean by any stretch of the means that if there's ever a complaint in a food establishment, I would still go. So this is just the annual inspection, take a little bit off my plate to get everything ready for when the new year comes. again, I will be the one, if there's any kind of reinspection from a naughty establishment, I would go and do that follow-up, as I did in December. Those are, that's for the budget. So I gave you guys a copy, and if you guys have any questions, we can, Chairman, if you feel like you want to put it on the agenda for the March, these are our, if you have any questions, what any of these items mean, obviously, budget is not on our agenda, but I wanted to give it to you for the March. At some point, I will be going to finance to hopefully get the approval from
Doug?
finance to go to town meeting.
So you don't have a date for that at this point?
I do not, I have not been invited,
Okay.
but I'm sure somebody will reach out to me. So we hired a full-time office administrator. Unfortunately, she did not stay. She resigned on February 7th. She sent an email to the Human Resources Coordinator, and that next morning, I was notified that she quit, so that she resigned. And I think it was, so in the interview, one of the main questions we ask is, do you have Microsoft experience? Excel, Word, whatever. The office is run off of Excel and Word. It is, we're not pencil paper type of people. Everything's in the computer, everything's in. So, the knowledge that the individual had did not, I'm not able to teach somebody Excel. I am able to train somebody, and you're sitting there for 3 days, and you're just not going to get it. You're not going to get it in 3 days. You're not going to get all the office procedures and everything in 3 days.
Question. During the whole application process, is there an attestation that they must sign of the qualifications, like, I am proficient in Excel,
Yes.
or et cetera?
So there's a questionnaire that Human Resources has, and so those are the bulleted things that we ask, and those are written down as notes, if that's what you're asking. Now,
Do they sign anything?
no,
that might
now-
hold a little bit more weight?
yep, so now
They read
we
out.
are going to bring back the Excel and Word test. So I have a special little spreadsheet that I will give, and I'll say, can you do this? And
Was
see if
that
they can do
something
it.
that you did in the past?
Yes.
Okay.
Good idea.
She, absolutely loved her.
Yeah.
She was,
Too bad.
yeah, I really thought it was gonna pan out, but
Sometimes it just doesn't.
sometimes it just doesn't.
Yeah.
And again, I had said, to many people, anybody out there looking for a full-time job, and the first thing people say is, how much does it pay? And when I tell them, they're like, yeah, right. But they don't understand the benefits later on. There's,
Yeah.
there's a package at the end of it. You get great health insurance benefits. So there are positive things. Yes, the pay is what it is because it's a union position, and that's what it's budgeted for, so. It's really hard to find people that want to work.
And that's across the board everywhere.
Yeah, and we put it out there on other platforms. I had a quick conversation with the Human Resources Coordinator, and she's just being inundated, even though there are certain things that you need to check off on Indeed to even open up the job description. Or I don't know exactly how it works, Stacy does, but she put some minimum requirements And, we're having RNs and LPNs and all these people that are applying for this job. For whatever reason, they got laid off, way overqualified, or they just didn't get vaccinated and they don't want to, or, somebody that's just not qualified, and they just have to check it off on their list for unemployment that they are looking for a job. So it's frustrating. And obviously, the office takes a hit. We've got myself, full-time, and one part-time assistant in the office, and unfortunately, those are the hours, and sometimes things come up, i.e. today, I did not have my laptop here to do the presentation, and Gino didn't have his laptop. I asked Doug Lapp if he had his laptop, and he's like, I didn't, and she was at lunch, so I had to shut the office and run home. But let's not forget, too, that I deserve a lunch hour. So sometimes I just need to get out and get lunch or whatever. So there are times, and I'm sure it's so inconvenient for residents, but on the door, there's notices. We leave the sticker form there for people so that they can sign it. We leave what time we're coming back. If it's something that's scheduled in advance, I do put it on the website. I do let the board know. And, there's really no other way to get the information out there to the residents, because they're not going to check the website to see if, the Board of Health office is open. They're just going to come in. And I know that's frustrating, and I totally understand it. However, it is what it is. We put out information on WRPS, the town's website, Twitter. I try to get the information out there as best as I can. Unfortunately, it doesn't always work for some. And I understand that, but yet we are working on finding another full-time person. So we still have an abundance of test kits. Residents can come up to either the Board of Health office or the Board of Selectmen's office. They need to show proof of residency, i.e. a picture ID, and if their picture ID has a different address, they just need a current bill with their Rockland address on it. Two Saturdays ago, they had a drive-through test distribution. I am told that it was run very efficiently. Member Christine Stewart was there representing Board of Health, and so with all that, I think they said 800 cars went through.
700, a
Yeah.
little over 700.
A little over 700.
Yeah.
And we have over 12,000 kits. So the kits are in my office, the kits are in at the senior center, the kits are at McKinley, the kits are in the Board of Selectmen's office. All residents need to do, they can come once a week and get test kits.
And you're giving out 2 at a time at this point?
2 at a time, as
And
versus
two tests per kit, 2
2
kits.
tests, yep, so you're getting 4.
Right.
The difference was at the,
4 tests.
yeah, the
2
drive-through,
boxes.
they were only giving 1.
Correct.
Yeah.
Yes, and at the drive-through, we didn't know, I'm actually part of the CERT team, so I was there as part of the CERT team, and so we didn't know how many people were going to come through. We had absolutely no idea of knowing how many residents were going to come through on that day. It was open all day long, from 8 o'clock in the morning until 4 in the afternoon. So we had no idea, we had no way of knowing how many people we would get through. So the initial idea was that they would give out 1 test kit, 2 tests, 1 box, to be careful, per household. And we ended up having a lot left over. So they may at some point be doing another one in the future, depending on how things go in terms of passing out, tests at the town hall and at schools and whatnot. So, but it did go very smoothly.
And it was a balmy 50 degrees.
It was a really nice day for our crazy New England weather. So that was really nice that we had a good day, and it was great that we had as many people as we did. Unfortunately, not as many people came through as we would have liked to have seen, but that's okay, because we still have lots of tests.
We
So
still do. And these are not the ones from the Biden administration. These
Correct.
are test kits that came from CARES Act money that between Doug Lapp and myself purchased. Unfortunately, we don't have any more N95 masks to give out. We had a surplus box full, and they went, and then one day I found another box, and those were all gone. So we are completely depleted of those. Trash.
Do we have access to get more?
No,
Do we have anywhere?
I asked.
CARES Act money, anything like that?
No, CARES Act money's gone.
Yeah.
So, trash, and I just want a reminder to everybody that residents, when it snows out, they need to clear a spot for their trash tote. The arm of the truck can't go up and out. It can only go out so at such a height, it can't go up any further. So if your trash tote or recycling tote is on a snowbank or behind a snowbank, the trash will not be serviced. It is the responsibility of the residents to make sure that there's a clear path and that the totes are accessible by the truck. And again, I'm going to push my favorite thing ever is the Rockland Trash
Trash
app.
app.
I love that app.
it is a great app.
I love it. I use it every week.
Yeah.
Yeah.
I went to use it the other day, and I forgot I had to do a factory reset on my phone, and I have to reinstall it.
Oh, you better go get
I
it.
love it.
It is the best thing ever, and it is great means of contact. People can contact me, but not me. I'm sorry, so when I say me, they can contact the Board of Health office directly. And we are able to say, if there's a trash day due to the weather, again, I'll update the trash app, I'll update the WRPS, I'll do all the standard updates for residents, but the best means of communication is the trash app. It's a great tool,
Great.
and that's it.
Awesome. Thank you so much.
Okay.
And with that, I guess I would like to entertain a motion to adjourn. Oh, do we need to set up the next meeting?
We do have it set up.
We,
Yep.
Okay, we do. Well, actually, it's March 22nd, right?
Yes, it is.
March
That's
22nd.
about February, March.
Yeah.
Days fall the same.
They always, don't they?
Except-
Except for a leap year.
Leap
Yeah.
year, no.
Yes.
So, great, all right, so
Does
with that.
anybody have any questions?
Questions? No?
Nope, I'm good.
Janine, any questions? No, you good? Okay, very good. Kathy, thank you again for coming.
Thank you, Kathy.
I appreciate it. Yeah, please thank Mike again for the presentation.
Yeah, that was terrific.
Yeah,
Yeah.
very good. And with that, I'd like to entertain a motion to adjourn.
Motion to adjourn.
I have a motion, do I have a second?
Second that.
All in favor? Awesome, thank you.